Okay, we're going to do some trach care to Mrs. Smith here. Before I went into the patient's room, I went ahead and gathered my supplies. I needed to get a trach mask to oxygenate my patient, a sterile suctioning kit, some saline syringes, and then a trach care kit as well. Also, I want to make sure I have resuscitation bag just in case the patient needs some manual ventilation during the process. So I'll go ahead, enter the room. Hi, Mrs. Smith. My name's Kate. I'm from the respiratory department here. I'm here today to do some trach care so we can clean you up a little bit, okay? We want to make sure we communicate to the nurses and the staff who are that we're getting trach care done at least twice a day. So we'll communicate that with them to make sure that everything is good. So the first thing I'm going to go ahead and do is assess my patient. So I'll wash my hands, put on some gloves, and Mrs. Smith, we're going to go ahead and lay you back a little bit here, and I just want to listen to your breath sounds, check your respiratory rate, your SpO2. Take some deep breaths for me. Okay. We're also going to make sure, or we'll ask the patient, are you having any troubles with any discomfort? Is a trach bothering you at all? Is it itchy, irritated, anything like that? We can put that on our report afterwards. So we'll go ahead and get started. The first thing we'll do with trach care is we need a suction, and that part is a sterile process. So we'll get our sterile suctioning kit. I also did bring a suction wall mount, make sure we have that set up prior to doing or getting our sterile technique out. We'll open everything up. I'll have to put on another set of gloves. I already did that. My left hand will be my clean hand, my right hand will be the sterile hand. We'll go ahead and hyperoxygenate Mrs. Smith. Real quick part with my assessment, I do want to make sure I monitor her cuff pressure, and it needs to be in between 20 and 30 centimeters of H2O. So now that we hyperoxygenated her, I put some lube on my sterile hands, and we'll go ahead and hook this up to the suction, or lubricated this part, and I'll go ahead and insert the catheter. When I feel a little resistance, I know I've hit the carina here, so I want to back up. Patient's probably going to cough. Go ahead and suction, occlude the thumb port, and suction her out. Go ahead and leave that there. Now I can go ahead and give her a little bit of oxygen after I did that. We'll go ahead and open our care kit. This is we want to make it as sterile as possible. It's the aseptic technique that we'll use. So we have, utilize our table here. We have some gauze. We'll set that out. The inner cannula can be disposable or non-disposable, so we need to make sure what kind of trach we have when we're doing that. Mrs. Smith, I'm just going to hold down the flange here, and we're going to go ahead and take the inner cannula out. So we take out our inner cannula, and this one is a disposable one, so we can go ahead and get rid of it. If it were a non-disposable, we do have in our care cleaning kits pipettes, and we have the sterile saline. We can go ahead and clean it out and let it air dry, putting it in a secure spot. Next, what we want to do, I'm just going to take off this old gauze. In our kit, we do have some new gauze, and then we do have some cotton swabs. We're going to go ahead and put some saline on there, and we can clean our trach. We can hold on to, we'll hold it this way, and we'll hold on to the trach while we clean. We're always going to go from the inner site outward, and then disposing each one as we go. Pull out the next one, inner and outward. Same to the other side. Meanwhile, while we're doing that, we're examining the stoma and making sure there's no pus, redness, irritation, things like that, swollenness. So Now that we went ahead and did that, we'll go ahead and replace this tie. Make sure it's nice and clean. We can, before we tie it down, we'll get our new gauze, place that in there. Tie down, secure the stoma. We're going to put our new inner cannula in. Okay. We can make sure, we'll assess our patient now, make sure that everything feels comfortable. There's no, the gauze isn't all bunched up. It's not like bothering it anyway. We'll make sure we check the cuff pressure again in between that 20 and 30 range. We're going to check the patient's SpO2. We can listen to her lung sounds again, and set the patient upright, let her be in a comfortable position, and that she has her call light ready and handy. Clean up all supplies, wash her hands, and document and communicate with our nurses.